Hello everybody, this is Chris Ruisi, the coach. I'm here with Dr. Jennifer Walden in her lovely office here in Manhattan. Dr. Walden is an accomplished physician specializing in plastic surgery, things of that nature. And I got to meet her through a common friend, through Facebook, so those of you who aren't out there on social networking, get out there. And you're probably wondering, why as a business coach am I here today talking with Dr. Walden? We're going to talk about healthcare. Well, it's very simple. As a business coach, healthcare has a dramatic effect on small businesses. When I mean small, I mean up to $500 million in revenue, if not larger, if the current plan that are being considered in Congress are passed. So I thought it'd be helpful to get a physician's perspective on healthcare as to what would happen if, in fact, socialized or nationalized medicine were to become a reality in our country. So, Doctor, thanks again for your time. I know you have a busy schedule.
Sure.
You know, with nationalized or socialized medicine, what do you see would be the impact not just on the quality of care, but also the quantity? What would be available for people?
Well, I think with a nationalized healthcare program, it probably will follow the lead of countries like Great Britain and Canada, where the quality of care is going to go down because there are fewer surgeons and doctors that are able to take care of many, many patients, and the quantity will also go down as well. I think patients will have a hard time getting in to see their practitioner. There will be probably long waiting lists, that sort of thing. So I am not in favor of this particular healthcare plan.
Okay, so the government hasn't demonstrated its ability to run many things well, and we have no reason to think that this would be run. In fact, even the estimates coming out of the Congressional Budget Office indicate that over a 10-year period of all they track, it'll generate about a $240 billion deficit, and they project that it'll continue to generate deficits after that. In the past, we've always seen doctors as the best and brightest of individuals who go into medicine. They make that commitment, if you will.
Right.
And as I mentioned to you when we first met, my son decided to become a physician.
Yeah.
I said, don't do it for the money.
Right.
You have to do it
It's
because
good advice.
because you have to do it because you like people and you care for them and you want to make a difference. What do you think a nationalized or socialized medical program will have on the numbers of new physicians and the quality of them?
I think that probably the number and the quality is going to decline because physicians are going to start getting declining reimbursements. We don't go into this for the money. We don't make a lot of money. Now, I'm in plastic surgery, so people could say, hey, doc, you're in a fee-for-service industry, but cardiologists, internal medicine doctors, pediatricians, OB-GYNs, it's
The people
hard.
who provide the majority of the care.
Medically necessary care don't make an extraordinary amount of money. If you want to make money, go into law, go into business, that sort of thing. But we're seeing that if there is a nationalized healthcare program, it would probably cause a decline in the best and the brightest. Now, I trained and I entered the workforce in my early 30s. I deferred even making any money whatsoever to train to become a surgeon. And that's a huge marathon to ask someone to do and then to go into practice and to go further into that after medical school and residency. People won't do it. They won't be able to just pay their bills and put food on their own table and pay their malpractice premiums.
So we'll see a decline in the number of doctors, which is already a problem today,
Correct.
and probably the quality of them.
Right. If I had a son or daughter asking me about medical school today, I would probably tell them that it might not be the best idea because of the proposed healthcare reform.
Okay. One of the things that makes our system stand out, why people come to our country, is the pace of research, development of new protocols, new medicines, things of that nature. In fact, I read recently that the government probably contributes about $30 billion a year to that effort, which is probably a good place for the government to stay involved.
Right.
But if we go to a socialized program with the types of deficits we're seeing, we're projected to see, what do you think that'll do to research?
Well, I think research and development would decline in a socialized and rationed healthcare environment. I think the billions of dollars are going to go towards trying to cover every single person in this country, whether they are here illegally, whether they want insurance or not. And so you would see a decline in funding for research and development, which is really the strong suit of the United States of America, because we have a capitalist spirit and we have venture capitalists that will buy into medical device development and pharmaceutical development and that sort of thing. And so I think that would definitely take a hit in the United States.
Now, one part of the Hippocratic Oath which you took states that you will never do harm to anyone. Now, again, under a nationalized, socialized program, how can you live up to that? Because your hands are going to be tied in terms of the types of treatment protocols you can prescribe.
Right. Well, if I was, say, an internal medicine doctor in OB-GYN, and someone told me what I could and couldn't do or provide for a patient, I would think about not staying in practice. I would not let the government do that to me or my patients, because I did take that oath. So we as physicians have to be able to provide the best medical care possible with what we have available to us. And any straying from that is going to cause a huge and dangerous problem. And so we would never want to be in the position where the government told a doctor what treatments could be afforded or what treatments could go for a patient, or a patient what doctor to go to, or that they could not see this specialist at Memorial Sloan Kettering, whereas that's where they wanted to go and could go.
Okay. Reminds me, as we were discussing before, the case of this lady, Barbara Walters in Oregon, who was told because of her advanced stage of her cancer that they would not, the state there would not provide for the medicine which would prolong her life, but rather they would pay for an assisted suicide. You know, that magnified over 50
Yeah.
states is a scary thought.
It's very scary, and it's particularly true for, say, elder patients, parents. I worry about that, and now I'm a doctor, so I can help my parents navigate the healthcare system and demand the quality that they deserve and that's available to them. But I worry about people in poor counties and states and in tertiary care centers where they don't even know to stand up for their own good.
There's a lot of misinformation going around, and you shared with me that press release from the College of American Surgeons. Did I say that right?
American College of Surgeons.
I had it backwards, but I had all the words in it. About some of the statements that President Obama made about the cost of an amputation versus a different practice, a different procedure, or taking out tonsils and things of that nature.
Yeah.
How incorrect were those statements?
Well, the American College of Surgeons just came out and issued a press release stating that they were deeply concerned with some of the statements in the town halls that the president and his staff had made, and they just feel like, while they might have been well-intentioned, they were misinformed. They were not informed because that's not their business. They're not in the business. And so, you know, things like getting paid for an amputation, a doctor would get $10,000, where the Medicare reimbursement for that is $740 to $1,100. Nobody gets $10,000 for an amputation, and that's something that a doctor does not because they want to or that they want to bill for the procedure. They do it because it is a decision at the end of a treatment algorithm, whether it's after a traumatic car crash or a person with diabetes with a horrible infection. Doctors do procedures that are clinically indicated for the best of their patients, and to put that out there about doctors wanting to take out tonsils just to get paid is a very dangerous statement, because that's not true. Board-certified ear doesn't throw doctors.
It just continues to the confusion and the fear that we're seeing today. An awful lot of information going on, misinformation, things of that nature, which is driving a lot of the emotion we're seeing.
Sure.
What would you tell your patients, the American people, to do right now?
Just to stay informed, talk to their doctors, talk to their family members about this. Don't take every word you're hearing from the elected officials as verbatim and truth. Question authority, you've always been told that. And to basically talk to your elected officials about this. Voice your concern, because that's why you're living in the United States of America, is because we have the freedom to voice our concerns.
Good point. That's a good place to end this. You know, we elected our officials, and this is not my thought, I read this the other day. We elected our officials to look out for our best interests. With that comes our responsibility to tell them about that. So go to a town hall meeting, get your questions, be professional, be diplomatic, but be like a tough dog and hold on till you get your answer. I want to thank you, Dr. Walter, for your time. It was a pleasure.
Thank you very much.
Thank you.
My pleasure.